How does ketamine stop seizures? This was the most common response to a video that I posted on the effectiveness of ketamine for terminating seizures that aren't responding to benzodiazepines. And it all revolves around which receptors that affect the central nervous system that we target on a cell. Receptors are specific sites on a cell where chemicals can bind to. And when chemicals bind to those receptors and they cause an effect, those chemicals are known as agonists. When chemicals bind to those receptors and they inhibit something from happening, they are antagonists. When we use benzodiazepines to attempt to terminate a seizure, we are targeting GABA receptors or GABA receptors, gamma aminobutyric acid. When GABA binds to GABA receptors, it causes inhibition. It causes inhibition of the central nervous system, so it's an agonist. We do the same thing with benzodiazepines. They bind to those GABA receptors and they cause an inhibition of the central nervous system. And this is what terminates that central nervous system overactivity in seizures. But sometimes those benzos aren't enough. The patient can become resistant to them, and so that's when we use ketamine to target different receptors. The NMDA receptors, N-methyl-D-aspartate. The NMDA receptor actually causes excitation of the central nervous system, and ketamine is an NMDA receptor antagonist. So ketamine binds to the NMDA receptor and inhibits excitation of the central nervous system. So with benzos, we're attempting to cause an inhibition of the central nervous system. With ketamine, we're attempting to suppress the stimulation of the central nervous system. GABA is inhibitory, NMDA is excitatory. Benzos cause inhibition, ketamine stops excitation.